All right, we'll go ahead and get started. Hello, everybody. Welcome. Thank you so much for tuning in for tonight's panel discussion hosted by Healthcare for All Oregon on the passage of Measure 111, the historic passage of Measure 111, and the next steps as we move forward towards a universal healthcare system and single payer here in Oregon. My name is Valdez Bravo. I use he, him, his pronouns. I have the honor of serving as the Vice President of Healthcare for All Oregon. And I'm just so excited to be moderating this exciting panel discussion tonight. We know that there are folks tuning in who are very well aware and probably go way back in with HAO's history and involvement, but there may be folks of you that are not familiar with the work of Healthcare for All Oregon. And so we'll be talking a little bit about our organization, what we hope to achieve, how we hope to achieve it is kind of the big part of that. Tonight you'll be hearing from Tom Sinsick, President of Healthcare for All Oregon, who brings his experience as a clinician, having seen up front, close and personal, the system fail the people he was trying to serve. You'll be hearing from Dr. John Santa, who brings his long experience in the insurance industry to help illustrate about why we need a different type of system. And finally, we'll be hearing from Matt Keating, policy advisor from the Office of Senate President Pro Tem James Manning Jr. And Matt brings his experience in legislative policymaking will help us craft the language needed to enact recommendations of the Joint Task Force on Universal Healthcare. And of course, couldn't do without that technology. Thank you so much to Zainab Aladina, who is an HCAO board member and our HCAO legislative chair. So thank you so much, Zainab, for keeping the folks getting admitted and running the technology. So this meeting is being recorded. And we'll just FYI, so folks that couldn't make it tonight will have a chance to make it. And I do see one hand up. Randy, did you have a quick question?
Yeah, this is Randy. My question was, could you please activate the closed captioning for the hearing impaired?
Sure. Tom or Zainab, can you activate the closed caption feature? Good looking out, Randy. We'll work on that. All right. And with that, I'll get going while they get to closed captioning going. So one of my favorite quotes of Dr. Martin Luther King, of all the forms of inequality, injustice, healthcare is the most shocking and inhuman. So this is something that we hold very near and dear to our heart, the work we do at Healthcare for Oregon. For those of you who may not be aware, Healthcare for All Oregon is a 501c3 not-for-profit located here in Oregon. And our mission is basically that we educate about and advocate for an equitable, affordable, comprehensive, high-quality, publicly funded universal healthcare system, which will improve the lives of individuals, families, and communities all across Oregon and throughout the United States. Healthcare for All Oregon was about 22 years old this year, and we have chapters all over the state, board members with representation all over the state. So we really try to make sure we have a statewide presence and voice, and we have the most amazing members spread out through all over the state. So I was gonna sing a little Christmas or holiday jingle for you, and so here it goes. Oh, the fragmented healthcare system is frightful, but single payer would be so delightful. And since we've such a ways to go, HCAO, HCAO, HCAO. All right, so that's probably too much singing. This is not a variety show, but we did just want to say that we feel that Oregon is really leading the way with this passage of Measure 111, which we're going to be hearing about momentarily. There is a lot of good work happening in the country, but Oregon really has has positioned itself well to be the first state to make this happen. And our hope is that if Oregon can get it done, like so many other states where groundbreaking legislative policy has happened and then other states fell in line and started to adopt it. And Oregon has done this so many times, whether it was with death with dignity or medical marijuana, OHP. Oregon has led the way on the medical front so many times. Oregon is again leading in this effort, and we hope to be the first state. And that when we get it done, other states will be able to follow. So yeah, a domino system in very much a good way. All right, with that, I'm going to hand it over to Tom Sinsick, President of Healthcare for All Oregon, to talk about the implications of Measure 111 and that new Article 1, Section 47 of the Oregon Constitution. Take it away, Tom. Tom, if you're speaking, I can't hear you.
Okay, thank you all for joining. A very exciting moment. See, this first slide says healthcare transformation, both necessary. For many of you on this call, probably all of you know that it is necessary. And when it comes to the issue of, is it possible? Yes, it is possible. And that's what we're going to be talking about today, how Oregon now has a clear path to possibility. And so look forward to making it happen here in Oregon. Next slide. One of those things that has now made it possible was Measure 111, the right to health care. Thanks to all of these organizations, and there were 58 of them that were signed on in support. And you can see there's a large variety. Don't have a screen big enough to show all of their logos, but from all over the state. So along with this coalition, it was people voting every part of the state that gave a clear historic win for Measure 111 now and the right to health care in Oregon. So now we have a mandate to move forward to the one system that's going to make this possible. That's a single payer universal healthcare system. Next slide. Well, we got two things. How are we getting there? How is it possible? Well, Article 1, Bill of Rights, Section 47. We'll go over that briefly in a second. And secondarily, we have already in the works the recommendations from the Joint Task Force on Universal Health Care to create the Universal Health Care Plan Governance Board. And the work is in the legislature already, and you'll hear about that later, to make that happen in the 2023 session. Look at those paths going forward, right? We never know which path we're going to be on at any given moment, but the road won't be the easy one, likely, but we have the ability to get on any of those roads and get to the finish line. Next slide. Okay. For all those that haven't seen it, it was in your voter's guide, but it is the obligation of the state to ensure that every resident of Oregon has access to cost-effective, clinically appropriate, and affordable health care as a human right. Not going to read the rest of it, but you can find Article 1, Bill of Rights, Section 47. It's not at the state website yet, but if you look up Ballotpedia, it follows Section 46, along with voting rights and other items that are in the Constitution. So sometimes people have questions about, well, how can we get this done? Well, or doubts about, will this be challenged or things like that? Of course, every constitutional right has been challenged and challenged over and over again. But we're going to be able to defend against any challenges and make it happen. So next slide. Just a little thing about the task force, right? The task force on universal health care shall produce findings and recommendations for a well-functioning single-payer healthcare financing system that is responsive to the needs and expectations of the residents of this state by a set of purposes, values, and principles, which you can find at our website. With that, I'm going to turn this back to Valdez and have John Santa, a member of the task force, go on.
Thank you so much, Tom, for that overview of the historic passage of Measure 111. Oregon really is the first state to have enshrined healthcare as a human right in its state constitution. And I know I'm so proud of that, as I know many of you are as well. So next up, we're going to hear from Dr. John Santa. John Santa is a retired primary care doctor and health administrator. John has worked for multiple healthcare organizations as a health policy leader, including 6 years at Consumer Reports, directing health ratings, and 5 years at Open Notes, a national movement to encourage easy access to clinical notes. He is a member of the Oregon Health Policy Board and feels fortunate to have been involved in implementing many health policies that most experts predicted would never happen. Please join me in welcoming John Santa. Thank you, John.
Thank you, Valdez. And I'm so excited to be here. And I'm excited because I get to meet and talk to so many people I admire. I've been on the Oregon Health Policy Board for 5 years, and prior to COVID, when we would travel consistently, when we'd have public meetings throughout Oregon, I would see people from Healthcare for All Oregon there. and interacting, making suggestions, giving us feedback. And it's great to present at a meeting of you all. Next slide. So the Task Force on Universal Health Care. Tom mentioned Senate Bill 770. The task force was created, but more importantly, inspired by Senate Bill 770 that had been passed at the 2019 legislature. An incredible document that made our task so much easier and worthwhile doing. Now, this took 2 years of deliberation, hundreds of hours of participation for each member. We worked hard in multiple work groups and realized this was all through COVID. We only met once in person at the very end of the process back at the end of September. So we worked hard at this. We're very proud of that. We pursued multiple efforts to engage the public, resulting in informed feedback, influence on our priorities and recommendations, but especially inspiration. I just can't tell you how many people told us about their lived experiences, their stories, and those were so inspiring to us in our work. We made multiple recommendations, many more than we have time to talk about tonight. For example, we strongly support a federal super waiver that would make getting to a single payer far easier. But I want to emphasize, we also strongly support a state-based single payer that will have to work with the federal government, but we think would be possible tomorrow if we really put our minds to it and we really transfer power in the right way. So my conclusion from the task force was that a single payer will especially reduce health inequities. It will transfer power because it transfers resources. It will succeed in large part because it will reduce wasteful administrative services that are costing us a bunch of money and actually harming our health. It can be done. But now doing it is going to require a moonshot. You know, another committee, another group of hardworking folks like the task force can't start this up. To be credible, the public has to see we have the kind of support that a moonshot has. And that means resources, and that means political commitment. And that's what we're asking the 2023 legislature to do. Next slide. What are we asking them to do? To actually create and fund a nonprofit public corporation that would be governed by a board, that would be charged with starting the universal health plan. That was the term we used at the task force, to start it up and eventually operate it. That board and corporation would report to the governor and the legislature. Its values would be consistent with those outlined in SB 770. So we want to keep going back to those values. And if you haven't read them, read them. They are inspiring. There would be board members that would have significant experience in operations, finance, the delivery system, actuarial analysis, public administration, and doing startups. These folks would be full-time employees who would have staff and a consulting budget. There would also be board members who have experiences in Medicaid, Medicare, disability, and other relevant lived experiences. These folks would focus on continual engagement with communities throughout Oregon. They would also be full-time board members with access to staff and consultants when needed. You know, the task force thought a total number of 9 folks would be where the discussion should start. 5 really oriented to that business startup process, 4 to the engagement process, but all 9 of them constantly interacting and interacting with staff, consultants, and other folks throughout Oregon. This process would be subject to Oregon's transparency laws. So public meetings, public records, the ethics standards, and other administrative procedures. Right from the start, the board would have a government-to-government relationship with the tribes. Next slide. What would its tasks be? First, engage communities. It's with the plan that eventually the Universal Health Plan would organize regional entities that would be within the Universal Health Plan that will focus on Oregon's communities and delivery systems. So there would be regionalization in terms of advice and decision-making, et cetera. The second is, I think, really important that the startup would actively engage the delivery system in an advisory process that would be focused on delivery system models and options, a budget and how reimbursement would follow from that budget, how we would focus on administrative savings, and how significant those savings would be on both the payer side and on the delivery system side. We're talking about billions of dollars of administrative savings here. And so both sides of the equation here would need to work together to maximize those. There would be significant effects on the workforce. As most of you probably know, our workforce is not in great shape because of COVID. A lot needs to be done to get it back going, and a lot would need to be done and could be done in a very positive way with the resources that would be freed up when a single payer is created. And of course, if you're going to succeed at a moonshot, you've got to have a very detailed and dynamic transition plan to move from Earth to the moon. A third task is to develop a dynamic economic and actuarial model that would allow a variety of options to be more fully evaluated and to be adjusted, again, to try and maximize the efficiency of the single payer. A fourth task is that there would need to be a team organized and endorsed by the governor and the legislature to sit down with the federal government and talk about waivers or other options for relating to the federal government in Medicaid, the Affordable Care Act, and Medicare. And Medicare is probably the most important of those. With all of those tasks, then a revenue plan could be developed that would inform Oregonians about the resources that would be needed to succeed at this. Next task. Next slide, I'm sorry. In closing, what's the goal? You know, at the Oregon Health Policy Board, every meeting, we're reminded of the goal of the Oregon Health Authority to eliminate, let me underline, eliminate health inequities by 2030. I strongly believe that if we're really serious about that goal, the best and likely only way we're going to do it is by transforming the system via a single payer. It will be important to create a collaborative environment with state agencies and with the delivery system. We have to have a payer and a delivery system that works together well and that trusts each other and knows what's going on throughout each, is transparent. All of this, we hope, will roll up to an implementation plan that will be presented to the 2025 legislature, who will make a decision on the next step. A key step, once that happens, is that the board would be expanded to include representatives from all of Oregon's regions and from its delivery system, so that the board, the governing board, would get significantly larger. So with that, I want to say, let's start figuring out this moonshot and how we're going to get this launched. Thanks.
Valdez, are we a little ahead on time? I could get a question in here.
Yeah, we are a little ahead on time, and I was just going to say, to echo Dr. Santa, that we are here for healthcare transformation, and we know now is the time and that it is possible. Go ahead, Tom.
This is a question from Bruce Thompson. John, do you feel that a state-based universal health plan would be better able to reduce the level of financial fraud that exists within the current national Medicare program?
Yeah, great question, Bruce. And actually, our other Bruce Goldberg, had an interesting back and forth. The actuary expressed concern that we needed to be careful to not reduce administrative expenses to the degree that the fraud and abuse that we have to make sure we get rid of would be impaired. Eventually, I think we all agreed that we would actually have a very strong fraud and abuse program because the single payer would have all the information about what's going on in the system, and it would be very clear where the accountability was. In our current system, fraudsters and abusers can easily hide amongst all the variation in the system, all of the payers, all of the cracks and spaces that they end up inevitably creating. Those folks watch for those weaknesses and attack, and no one, frankly, we saw this in COVID. It's difficult for anybody to be truly accountable for what's going on in the current system we have. So we're confident that the estimate about fraud and abuse savings is actually conservative. And that's one of the examples of how we think with more intense work and analysis, we can convince decision makers that we would outperform that conservative estimate.
All right. Thank you so much, Dr. Santa. Tom, can we move on to our next speaker?
I just want to say that these two things are tied together. I want to thank the task force and John for all the work they've done to get us to this point. And what you're going to hear from Matt Keating next is how this work is being taken up with the legislature. And that's what's so exciting. And it's so exciting to have everybody on here. Again, if you have questions, you can put them in the chat. We're monitoring that. And again, we'll have plenty of time for conversation and questions after we're done presenting.
Yes, we're doing great on time. So please do feel free to log your questions as you're hearing things that spark an idea in the chat, and we'll come back to those after we hear from our next speaker. Speaking of our next speaker, I've known Matt Keating for many years now, and excited to get a chance to work with him on this healthcare advocacy work. Matt Keating is the policy advisor in the Office of Senate President Pro Tem James Manning Jr., fellow Army veteran. So welcome so much to the discussion, Matt, and we're looking forward to you talking about the pathway to how we get there.
Okay, Matt, 1 second, and then Valdez, I'm going to give Matt the screen sharing permission. We want to let people say, look at that current thing. How are we going to get there? This is the key ingredient, persistence. Into the legislature, we'll talk about that later. And we're going to have more than one person pushing that big ball up the hill.
There you
go. So I'm going to go ahead and Valdez stop screen sharing, and we'll allow Matt to screen share.
Great. I'll screen share ever so shortly. I just wanted to say hello and thank you and praise Valdez for his pipes, for serenading us at the top of this meeting. It was very, very cool. I forgot what a stellar singer Valdez is. Back in DC years ago, we were at a conference and the two of us busted into Queen, Bohemian Rhapsody. And it was really Valdez that carried the day because I couldn't carry a tune if it was packed in my suitcase. Healthcare. It is my honor to be working alongside Team Senator James Manning Jr. on his signature bill, the Universal Healthcare Bill. I want to give thanks and gratitude to those who came before us because this moment in history is built on a legacy of legwork decades long. Lou Singinger. Where are you, Lou? I saw you on here earlier, a constituent of Senator Manning's. Lou, you've been in the trenches working for healthcare for a decade plus here in Eugene. I thank you for doing that. We're here because of your work, and we're going to get there because of our collective effort. As pointed out, many hands make light work. It's not one person pushing that boulder up the hill. This is a team effort. So thank you to the task force members, Senate Bill 770. Thank you, Healthcare for All Oregon. My role is to develop a thorough understanding of the work that came before, including the Joint Task Force on Universal Healthcare's report and policy recommendations, be a liaison with legislative and community coalition partners, organize regular coalition check-ins as we did throughout the day. I think this is my third or fourth Zoom with Tom Sinsek today. Track media coverage of universal health care, both statewide and nationally, review all state Senate and state House healthcare committee meetings, maintain awareness around other major healthcare legislation, and draft communications for legislative newsletters, op-eds, testimony related to universal healthcare. So don't be surprised if I'm coming back to you asking for a robust letter to the editor campaign or to write to your respective lawmakers. And finally, provide Senator Manning with weekly reports on bill progress, including action items, news articles, and key articulations for action. I would like now to share my screen, if I could, Tom, and share with you where we're at with Senator Manning's universal health care bill.
You should be able to share.
It's going through and almost there. Houston, we have liftoff.
Can you see my screen with 8 million tabs open?
Yes, we can see it. If there's any way to zoom in a little bit, but yes, we can definitely see it.
Let's see if I can make that bigger. How's that work, Valdez?
Yeah, much better. Thank you.
Okay, great. So as mentioned, the work that came before us, and as Dr. Santa pointed out, we wouldn't be here without the Universal Task Force 770 that completed single payer implementation recommendations for review and consideration. By 2025, this should be wrapped by the fall of 2025 and ready for implementation in 2026, 2027. I'm just going to scroll down a bit to the board size and composition, because Dr. Santa pointed out a really key piece in regards to the 9 members appointed to this board being full-time employees with a staff and with a budget. And I want to thank Representative Travis Nelson. I don't know if Travis is on this call tonight, but Rep. Nelson pointed out and articulated well the need for a diverse array of folks to be compensated appropriately for their critically important work, and that of course comes with a full staff and potentially under the governor's purview. Board authority. The board would have the authority to complete the priority objectives of the plan, including securing necessary waivers from CMS to administer federally funded healthcare programs, and the board would have the authority to hire an ED staff and consultants and embrace good governance as appropriately, as Dr. Santa pointed out. The board is really the next step from the task force to implement and realize universal health care. I put this in the chat, and so if folks want to print it out or save it on their desktop, I wanted to just be as transparent as possible. This is hot off the press, and I thank Tom Sinsek for putting this together with the stamp of approval for Healthcare for All Oregon on Senator Manning's universal health care bill. This is, for those who are tracking this as well, this is legislative concept 1249, LC 1249. It will get a different bill number, but if you want to read up on LC 1249 or print this off, you're welcome to. The workforce piece that Dr. Santa alluded to, in partnership with regional entities within the UHP to determine rates of reimbursement, identify innovative strategies, reduce complexities and burdens in the current system, and address workforce challenges. The finances is a critical piece. Dr. Santa alluded to revenue questions and the fiscal hurdles. It will be the board's responsibility to study and address impacts to specific the impacts specific to various employees, determine the details of UHP's administrative structure, and engage with the governor's office, the Oregon Health Authority, and federal authorities to secure federal funding sources and state revenues. Timeline by the end of 2025. Makeup of board composition, diverse array of board members from various health-related backgrounds, parking this under the umbrella of the governor's office, and being very clear that the goals and objectives are to further the role of the task force, and not go off in a different direction, but this is the next step in ensuring universal single payer health care for all Oregonians. I thank you for the opportunity to share this document with you. I rather than read at you, I do invite you, if you want to absorb the timelines, if you want to read more about the governance structure, or the overview that we've shared with you, please do click on the link and let me know if there are issues with downloading it. Literally, this is my first day on the job as the senator's healthcare czar, as his policy advisor on universal healthcare. So you're going to be hearing a lot more from me. It's good to see a lot of familiar faces on the call, and together we're going to get it done. Thank you so much for your time.
Thank you so much, Matt, for being here, and welcome your first day on the job. That is so and 3 Zooms with Tom Sinsick on your first day on the job. I think that might be a record for folks. Thank you so much for the work that you're going to be doing with Senator James Manning Jr. Advocating for this big legislative heft. I encourage folks to go and follow James Manning's, Senator Manning's website to get all of his updates. Of course, we'll be apprising you along the way. Well, more about how you can stay up to date on the movement via HJO at the end after the Q&A. So with that, we've heard from Tom Sinsick, our president of HJO, about Measure 111 and its passage. We've heard about Dr. John Santon, the work of the Joint Task Force, and now we've heard about the work with policy advisor to Senate President Pro Tem James Manning Jr., Matt Keating, on the legislative way ahead. So with that, we'd like to go ahead and open it up to questions. If there's some questions that have been fielded in the chat, Zainab, I defer to you, or we could look for hands raised, and we have about 20 minutes for questions before we start wrapping up. So I see a hand from Mary Lou Henrich. Go ahead, Mary Lou. Mary Lou's our awesome HCO board member and interim executive director. Go ahead, Mary Lou.
I will need to be unmuting people, just so you know, because everybody else can be staying muted so we don't get crossed. There's a lot of people on this call. It's almost 70 people. So
yes, thank you all for being here tonight. We really appreciate it. Go ahead, Mary Lou.
Hi, I just wanted to say thank you to all of you, and Valdez and Tom and Matt and especially John Santa for his time and the effort and expertise that he's brought to this, along with so many others on the task force. But I guess the one thing that I just did want to say that Tom has reinforced with me, and I want the whole group to hear it, this is Senator Manning's #1, basically only big legislative priority. He's putting everything behind it, and hiring Matt to be full-time on getting this done. I think that shows the commitment and how important Senator Manning believes this is. And I just want to assure people that we will be working very closely with our HCO members, with our chapters, with other coalition members, we're just going to be like glue on those legislators. I mean, they are not going to be able to turn around without going, healthcare again? My gosh, I didn't realize healthcare was the biggest issue in the world here. But by the time this legislative session is over, if we all do our work right, that legislature will be going, okay, we were scared about Measure 111 when we came in here. We weren't sure what we were going to be doing, but by gosh, we've got a plan. And so just everybody, gird your loins, get ready, and we're here to be with you. Thanks, Valdez and Tom.
Thanks, Mary Lou. Thanks for leading us during this time of transition at HJO. And yeah, and we're so lucky to have Matt. Matt's got years of experience in the political sphere as a Eugene City Councilor. And yeah, it's just a really strong policy advisor. So thank you, Matt, we're so glad you're dedicated full time to this project. How lucky this movement is. All right, next up, we have Lou Seneker with your hand up. Go ahead, Lou.
Hey, thank you. Well, thank you very much. Can you hear me? All right. I appreciate everybody who put this program together. And thank you, Matt, for standing in for Senator Manning and giving us a good view. We are totally supportive of a governance board, but my question is, does anybody have a concept or an idea when I talk to my various legislators, how much money a governance board will need to carry out its duties according to Senate Bill 770? Anybody want to answer that question?
$1 million question, Lou. Our office is putting together a budget, recognizing that there's staff, the need to properly compensate our board members and give them the resources to effectively do their job. So the one sheet that I've shared it with, I thought I shared it in the chat, but I can't chat everyone. So I've shared it directly with Tom, directly with Valdez. And the document, according to Tom, will be available on the hcao.org website. And so with that, it's hot off the press today. And so when we met with stakeholders today, we were very clear that our one of our next steps in our office is to develop a budget. And when I have those numbers, I will share them with you for dissemination, so you can articulate well with your representatives and your senators. But I know who your senator is, Lou.
Yeah, I know.
Thank you. Great question.
But I do get around.
Right.
Let me add, Lou, right now, you feel like you need it. How much is this going to cost? Like anything else, this is going to be carefully vetted. You can just say you're going to have all the information you need to look at these numbers as the budget gets developed. This isn't the only item that's going to be. There's going to be items way bigger expenses than this item that they're going to have to be looking at. So this is going to be a small potatoes budget compared to the bigger items that they're going to be looking at budget.
Yeah, thank you, Tom. Yeah, when I was looking at the task force recommendations, how we could be going from spending, what is it, 52 billion and having the current fragmented system that leaves millions of Oregonians behind, or we could save 800 million and spend 51.2 billion and have everybody in, nobody out, health, dental, mental health, the works, reproductive health. So that's where these savings come from. Do I have any other questions? I see hands come up, or Zainab, are you tracking any questions in the chat? I see Kate Thomas with her hand up. Go ahead, Kate.
Hi, everyone. Thank you so much for the evening and providing the information. I'm just wondering what the stakeholder engagement will look like, if that has been considered yet for people to support this legislative concept and the board in general, since there was so many opposition, such a tight race for 111.
Tom, did you want to take that one? I know that sometimes
I can take the first part. Matt can take this, follow up with me. I think would be the best thing. Okay, so keep in measure 111. Well, it was tight. We got this thing for between 10 and 20 cents a vote. That's unheard of. If there had been any money expended on this race, we could have crushed it. We had votes across every part of the state that added up to a constitutional change. So I like to reframe the idea that it wasn't as tight as it seemed. And we did what we needed to do to win, while masses of other resources were put into getting legislators elected, governor races, people in Congress, all of that stuff. We took a small amount of resource, and Emerson Hamlin is not here, but did a great job with Measure 111. And we had 58 organizations signed on, and we're going to be building on that. And so, and part of having Matt here, Matt, I'll let you go ahead and speak to that, is to take up this process of coalition building to get it passed. Go ahead.
Yeah, happy to. Those 58 partners who stood in support of Measure 111, that's the low hanging fruit, and those are the folks who did the work, and the thousands of persons tens of thousands of persons who belong to those organizations. SEIU comes to mind, AFSCME, Planned Parenthood, just to name a few. It's our charge to also assess the readiness of key institutions within the building in Salem, and develop a detailed plan of action in collaboration with the Department of Consumer and Business Services, the Department of Human Services, and determine how their systems will integrate with a universal health care plan. Work collaboratively with partners across the healthcare system, hospitals, nurses, doctors, insurers, coordinated care organizations, and help unwind the existing healthcare financing system for the better, to allow for every Oregonian, every Oregon resident to have access to quality care.
Thanks, Matt. That's really helpful. Any other questions? Mary Lou, another question. Go ahead, Mary Lou. And then we'll go to Cynthia Johnson. I saw Cynthia, you raise your hand. Mary Lou and then Cynthia.
Mine wasn't so much a question as a bit of a response about healthcare for all Oregon's legislative and engagement strategy. We are working right now on a strategy to identify in every district across the state a champion, the #1 champion with a backup team. We have almost 40,000 members in our supporters in our database, and we know them by legislative district. And we are working, through that list, coming up with and getting a commitment from people who want to spend their time in this next 7 months, really interacting with their legislator, and then having backup teams and having, others who can occasionally show up and help us out. But we are really strongly going to be organizing all of our supporters. And so if you're not already registered as a supporter of ours, a member of ours, please go to the website and do that. It is so important. But trust me, staff and I and board members are in the process right now. So, by January, we're going to be really having those teams ready and telling everybody about them and how to join with them. So thanks.
Thanks, Mary Lou. And one of my co-hosts, if you want to drop the link to the HCO page right there in the chat, we're going to be talking about how to get involved and how you can support this work at the end of the program. First up, I'd like to go Cynthia Johnson, and then Pamela Lyons-Nelson, you're on deck. So Cynthia Johnson, go ahead. My fellow Lake Oswego, I believe.
Yeah, nice. So nice to see you again, huh? I had a couple questions quickly. I'll throw them. I'll try to frame them in an optimistic, positive way here. I just wanted to see if there's coordination. Let's say, for example, the Medicare for All, the enhanced Medicare for All plan in 2024 started to happen. Are we somehow coordinating in a way or implementing our plan so that if that we can work together if things happen at the federal level faster than in Oregon? So I just wanted to see, I was involved, I've been active in healthcare advocacy for decades and on the Cover Oregon Consumer Advisory Committee. So I do know, how sometimes the best laid plans or other things can happen. Things do happen, but this is moving quickly. So I just wanted, and also the VA, Valdez, I wondered how do veterans in Oregon fit into this, or do we know yet? And also I am disabled by MECFS, and I wanted to throw out, as you even at the level of the board, you have to be creative to really have stakeholders or people with lived experience participate. Otherwise you're kind of go back to, so just as this all unfolds, I wanted to really take, particularly after a pandemic, or we're still in a pandemic, not after a pandemic, the disability voice, and make sure that is at the table from the board all the way through this. And that includes people that it's hard for them to participate in a traditional way. A lot of questions, just throwing out. Eddie, you can address on that because I know it's better to kind of start thinking of some of these things sooner than later.
I'll answer the VA question and then turn it over to Tom. From
Thanks.
I worked for the VA for 18 years, so single payer in the US, love that.
Yeah.
And it was really great. And there's a lot of lessons learned from the VA. But no, the VA specializes in military cultural competency, having unique skill sets to treat, America's veterans. And so the VA would remain, preserved, and there would always be a place for veterans at the VA.
So waivers for Medicare may come in, but not, the VA would still be a separate single payer.
Separate,
Okay.
yeah, exactly.
Thanks.
With Tom, do you want to talk about the other aspects?
Yeah, we're in close contact and watching what's going on at the national level every bit of the way. But what we find out nationally right now is the national people are starting looking for some state breakthrough. NNU is now, which is National Nurses Center, which is so known for its national work, is looking and focusing a lot of energy right now in California, trying to get a breakthrough there. For years and years, they just kept going national, and that's the realization where we're at, right? We're way ahead of the game, first in the nation. We've got the constitutional change. We're leading on this effort. John Santa knows that there's consultants from the state of Washington, staff up there calling into us and saying, tell us about what you're doing down there in Oregon. So, John, I think you got a meeting coming up, right? With somebody in Washington, you and a group, right? Can you go ahead and speak to that?
Right. Bruce Goldberg and Daniel Dietz and I, Daniel's staff of the task force, speak to the Washington Commission this Friday. What I did want to add in terms of this discussion is, as I looked at Medicare specifically, and I mean, I'm a Medicare patient, but this experience for me really showed me how inadequate Medicare is. The degree of cost sharing is disabling to many Medicare patients. That came across in some of our initial engagement activities. And yet you read the policy that CMS says they want to pursue in Medicare, and you wonder, only a single payer could do this. Only a single payer, only a Medicare Advantage plan that is implemented by a single payer. There's only one Medicare Advantage plan in the state, and it's the single payer, is going to be able to take care of 100% of the Medicare folks in a state, get rid of cost sharing at the point of service, and actually provide a dental benefit for on Medicare. That's a $500 million benefit, dental in Medicare. I came out of this feeling really discriminated against as a Medicare patient. Why doesn't the country feel concerned about our teeth? We have terrible teeth and we need dental, and how influential your teeth are when you make an impression. But we seem to not care about that in people who are over 65. That inequity should stop. It has to stop. And in my mind, the best way to get the federal government going is to have a state like Oregon banging at the doors, sending people to Washington, D.C. with legislations that has passed saying, we want a single payer in Medicare, and we think your policies in Medicare Advantage today should allow us to do that. And here's what we want to do. And see what they say.
Thank you, John.
Give it up for John Santa.
Before we go to Pamela, just want to remind people, we are going to wrap up at 7 o'clock. If we don't get your questions answered, send us a message. There was one question about, did Kaiser sign on? Kaiser did not sign on, but Kaiser did not measure 111, but Kaiser did not oppose. And the reason that Kaiser said they didn't sign on was they weren't really involved in crafting that little short piece of legislation. And I don't know why. I mean, Mitch Greenlee came out of Kaiser. But that was the reason. They didn't oppose, and that's all it counted. And Kaiser's going to wake up soon and realize that as on the service side, that this is the way the providers are going to be happier, the nurses, the physician's assistants, all the people that they're employed to do actual care for people are going to be a lot happier. So
we're going to go to our next question with Pamela. I just want to say I was talking to John Santa earlier today, and just so you know, I operate in some different groups, and my CEO type friends that run the healthcare systems, I've heard them remark recently about how during COVID, they realize that they can no longer have to be working against each other in the old model of trying to like get each other's patients and cases and staff. They really rely on each other to serve the whole community served. So eyes are opening in that world and there. And then just in fact of the beds, and we only have so many beds in Oregon, and hospitals are now developing systems and workarounds to the fragmentation of our system because they realize that they have to work together. The way a single payer would do that. So anyway, with that, Pamela, go ahead and ask your question.
Well, my question, I have two, but I'm only going to ask one unless there's time to ask another one later. And the first one that I want to ask is, how are we doing coordinating with the Indian Health Service? Because the basic thing wrong with the Indian Health Service is we have funded it half half what we should. So how are we doing with that? That is a block of people that isn't a block. It's many different individual tribes, but it's very important that I think that we build the trust with this group of people, because if we can build trust with this general group of people through coordinating well, or however we do that with the Indian Health Service, I think we have some ground to stand on with other groups that have found themselves outside the purview of what happens.
Yeah. Do you want to take that?
What?
Let me go ahead and speak up before John does. We're in close contact, particularly with the Confederated Tribes of Warm Springs, in a conversation with them. We've had a presentation regarding this at the Oregon Public Health Association meeting a couple of years ago about what it would mean for people that are tribal represented or not tribal represented, what they would mean. They understand the complications as well, and there is strong interest, at least locally, right? When we talk about this, there was somebody, John, could you maybe add to that? Go ahead.
Well, just, I'm glad that that's all happened, but I knew about that. What I'm wondering is, as a result of the task force, what new has happened to get this actually going with some actual things happening between IHS, IHS and HCAO, our plans? Is there anything new on the horizon?
If I could just say, from a task force point of view, we had strong representation from the tribes on the task force, with tribal representatives regularly attending all of our sessions and involved in our work groups. What was key was that we must have a government-to-government relationship with the tribes, and the tribes providers should be and have all the rights and access to the delivery system that all other providers in Oregon would have. I mean, realize in today's system, many of the tribe providers, many of the Indian Health Service folks don't participate in the CCOs. And you have a divided system that can be, very challenging. The tribes would have the best of both worlds. Realize the Indian Health Service is funded by Congress. So in order to influence the Indian Health Service, it takes an act of Congress.
Which leads me to my second question that I'll go ahead and ask right now. What is the thinking about how losing the House on the national level may or may not affect whether or not we get our waivers?
Yeah.
My own reaction, having been involved in waivers 20 years ago when I worked for the state during the second term for Governor Kitzhaber, is now is the time, because there's a Democratic administration that, especially when it comes to Medicare, I would be hopeful they would at least listen to us, especially if the Oregon legislature and governor clearly was behind and in support of where we're going. So in my mind, that's one of the reasons why the timetable that we have makes sense. We need to get something in front of the current administration and have discussions with them about how we could proceed. You don't need the House, I think, to pose those kinds of questions and make progress when it comes to Medicare and Medicaid waivers.
Especially if we can win over the right with the fiscal sense that this makes, which they purport to be all about. One thing before we wrap up here, I just want to say I appreciate the question about the impact on veterans and the VA and also on IHS. I'm one of those unique individuals that receives services from both the VA and IHS. I go down to Chihuahua on occasion. And so what I always think about in terms of my fellow veterans or fellow Native Americans is so many times because of that chronic historic underfunding of the VA, of IHS, wouldn't it be nice to have a universal healthcare system here in Oregon so that folks could go outside of that? There would be other resources available. And a lot of veterans can't get dental care unless you're 100% service connected. So even those folks would be able to get dental care under our new solution that we're all going to make happen. It's going to take all of us. So on that note, I do need to wrap up here. Just wanted to acknowledge that some of you already are familiar with the work of Healthcare for All Oregon. You're already members, you're in our database, you're receiving our updates. But some of you on the call might be, this might be your first time hearing from HCO or learning about our work. And if you're not a member, you're not receiving our up-to-date information about this movement. So if you're ready to become a member, you can go to, what's that? Share the screen. I'll share my screen. We have a QR code that if you check it out and hit your camera against the screen, you will be able to see that. So let me go ahead and share that now. There's our QR code. I'm not sure if it's coming up. There we go. So if you just aim at that QR code, it's a social favor we do. It saves you from having to enter hco.org website. It'll go right to the place. And please sign our statement and or become a sustaining member today. You can go in and simply add your name to sign our statement that you believe healthcare is a human right and you would like universal healthcare in Oregon. But if you're feeling particularly inspired by what you've heard tonight, please consider becoming a sustaining member. You can do it for as little as $5 a month. A cup of coffee a month. You can become a sustaining member and help HCO do this hard work. It'll make sure you're receiving our monthly newsletter, which we get good feedback. People love the newsletter. It's one, we're not spamming you. It's one monthly newsletter, but it's jam-packed full of awesome information. And it's got the latest developments on what's happening with this movement. And last but not least, be sure to find us for all of those of you on social media, Facebook, Instagram, and on Twitter. We want to thank everyone so much for coming tonight. Together, we can do this. All of you that tuned in are the ones that are going to help us make this happen, make this a reality, working to support the recommendations of the Joint Task Force, working to support Senator Manning and Matt and advocating within the Capitol, and HCO working with communities, diverse communities, a broad coalition all over Oregon to make sure that we realize our vision for universal healthcare system to make sure that no one is being left behind. Everybody in, nobody out. Thank you so much.
Contact your legislators now. Don't wait.
Don't wait. It's never too early to start sending them emails. It really does make a difference. Tom, any other notes? All right. Thank you all and have a great evening. Thanks for tuning in for this discussion tonight. Hopefully we'll do more in the future.